and board certified OBGYN. And today in this podcast episode, we're going to be talking all about baby care in the hospital. Who's going to be
Yep.
taking care of your baby when you're in the hospital, right? You know, a lot of patients, when they come to me for prenatal care, I will ask them, who do you want to take care of your baby in the hospital? And I'm surprised at how many expect that's going to be me. And it's not.
Yep. Nope.
Yeah.
Definitely not going to be her. Yeah. And
Yeah.
a lot of people don't realize that as soon as the baby's born, the baby is admitted to the hospital and become their own patient. They have their own team of providers, including their own doctor or nurse practitioner and their own nursing staff. So while you're in the hospital, you'll meet these people as well when they come in and out of your room caring for your baby.
Right. So you will see the mama doctors and the mama team, and also the baby
Mhm.
doctors and the baby team. So Rachel, start from the beginning. The baby is born. I deliver the baby, and as long as the baby looks happy, I put the baby right up on mom's abdomen, and I'm done. So tell us what happens then.
Exactly. So, and the key phrase there is as long as the baby looks healthy. And most of the time, 99% of the time, the baby looks great and healthy. And
Yeah.
your doctor's going to lay the baby on top of you, and they will have already placed blankets there, and they'll dry and rub the baby. And it's funny, when I was delivering JJ, I was kind of helping them dry and rub him on my belly. But the
You
drying
had to
and the
make sure they were
rubbing,
doing a good job. You had to make sure they were doing it
exactly.
right.
Exactly. It's not hard. But this kind of helps stimulate the baby to breathe and cry. And the breathing and crying is really important to open up their lungs and allow their blood to flow properly in their heart. So
Yeah.
that's the first step, and it's really important.
Yeah, but sometimes baby isn't doing well. Like sometimes I'll have a baby born and the baby's really floppy or not trying to breathe or purple and not trying to
Mhm.
breathe. You know, they're all purple when they're born, but as long
Yeah.
as they're crying and trying to breathe, it's fine. So let's say the baby's not doing those things. Tell us what
Yes.
happens then.
Yeah, if the baby's having any issues, and some issues are smaller, some are bigger, but if the baby's having any issues with breathing or really anything else, then the baby might be taken to another room or another part of your room off to the side to do a resuscitation. So it's called a resuscitation, even if the baby only needs a little bit of help with breathing. So don't freak out over the word resuscitation if you hear this.
Right.
But you might see the little baby warmer in the corner of your room that they have prepared already just in case, or it might be in a separate room. But during this resuscitation, the staff will take care of the baby, nurses and sometimes respiratory therapists, nurse practitioners, pediatricians, and sometimes even the NICU staff will come and help out the baby. If there's anything they need to do for the baby, they will let you know. And if they have to take the baby to the NICU for extra support and care, they'll let you know that too. Before they take the baby, they'll let you know. Usually the dad or like a non-birthing partner, the other mom, or your support person, if you don't have another mom or dad, are going to be invited to see the baby after the baby is stable. But during that time, their goal is always to bring the baby back to mom as soon as possible for the golden hour of skin to skin.
Right. I know in our hospital we try our best to keep babies in the same room as mom as much as possible,
Yes.
right? We try not to separate them. But you said the golden hour of skin to skin. Tell us what that is.
Yeah, so normally they will give you 1 hour for bonding and skin to skin with the baby right after the baby is born.
Right. And I think this can be something that you as a mom ask for in your birth plan. And you should
Yeah.
talk with your OB doctor and find out what their protocols are. What's going to happen with your baby? Is it going to be, if there's a resuscitation needed, can it be right there near your bed, or do they take the baby away? That kind of thing.
Yeah, and it really should be something that you ask for in your birth plan. Most
Right,
hospitals know about it and will do it for you, but
right.
if you ask for it, then they know that you know what you're talking about and you find that important too. So, but the first hour of life is really important for baby and mom bonding. And that's
Mhm.
why this golden hour is so important. It's important for bonding, temperature regulation, heart rate regulation, even blood sugar regulation, and feeding as well. So it's super important. But after that first hour, the nurses will come in to do the baby's measurements. They'll do the weight, the length, head circumference. They'll check the baby's vitals and give them their first vaccine and vitamin K injection. And we'll talk about those things later too.
So I know when my babies were born, the first thing they did was take the baby and put the baby right on the scale, right? So
Yeah.
now moms are not gonna know the baby's weight until after the first hour of life, right?
Exactly. And I have so many people who are asking all the time, what's the baby's weight? Well, we don't weigh them for the first hour. So you're going to have
Right.
lots of family members texting you even too.
Yeah,
Hey,
so
what's the baby's weight?
make sure you tell grandma and grandpa you probably won't have that weight for the first hour.
Yeah, exactly. Everyone wants to know it, but it's so important in the first hour to allow for that golden hour of skin to skin. And then after that, another golden hour is really important where mom or dad can do skin to skin, again, to regulate temperature and other things.
Right. Now, sometimes in some hospitals, they have birthing rooms and then postpartum rooms. So some moms actually will be moved from the birthing room or a labor room into a postpartum room or a mother baby room. At our hospital, though, we keep our patients in the same room the whole time. So we have, they're called LDRP rooms, labor delivery and postpartum rooms. So if you do move from one room to another, then you're going to get a new set of nursing staff for mom. But if you stay in the same room, you may get to keep your nurse with you for the postpartum recovery period. And that's important because you've just had a baby. You may have bonded very well with that nurse that's helped you
Yeah.
through labor, right? Yeah. Yeah.
Yeah, I didn't know there were hospitals that did it that way. Everywhere I've ever worked and the hospital I delivered at, you moved rooms and you got a whole new set of staff. But I agree, I think it would be nice because you bond with
Right.
that set of staff really well.
Right.
Um, but bottom line, either way, no matter if you change rooms, your mom's staff changes, the baby nurses and staff usually stays the same.
Right.
There's so many people that are going to come introduce themselves to you during delivery, postpartum. So don't feel bad if someone comes in the room and you don't know who they are. Just ask. Even if you've asked them before, say, hey, what team are you with if you don't remember?
And
Um,
they're all supposed to wear badges, hospital ID badges with their photo
mhm.
and their name and title. But yes, please ask if someone's picking up your baby, who are you?
Yeah.
They should
And for
introduce
safety,
themselves though.
yeah, they should. They really should. But I mean, sometimes they've introduced themselves before and you don't
Right,
quite remember. So if you don't remember, don't feel bad. Just ask.
right,
I
right,
know some hospitals too have like safety things in their badges
right,
that will let you
right,
know this is a someone who's acceptable to pick up a baby or take a baby from your room. Like
right.
where I worked at in Kentucky, the badges were yellow. If you were
Mm,
allowed to touch babies, take them out of the rooms, be transporting babies at all. So you knew if someone came into your room and didn't have a yellow badge, they should not be touching baby. So
gotcha.
you can
Good.
ask about that at your hospital as well.
Right.
Um, but in the first few hours, your baby's going to have their initial exam where a member of the baby team, a nurse practitioner or a pediatrician, will come examine the baby and make sure there's nothing concerning that was maybe missed in the beginning. The babies will also get vitals done every 4 hours, just like you. They'll take the baby's temperature, respiratory rate, heart rate, and all those good things.
Yeah, and baby vitals are so important. Rachel, why don't you tell us
They
why
are.
it's so important to monitor the vital signs of the babies?
Yeah, they're so important. Baby vitals can be an indication of a lot of issues that can happen with a new infant. A new baby has an increased risk for infection. You know that.
Yes.
They've just come through something that's not super clean most of the time. So they have an increased risk of infection and their immune system's brand new. So your baby team will give your baby a score based on their gestational age, how long your water was broken, your temperature during labor, if you were GBS positive, and if you received antibiotics during labor. They take all those things into account and then give your baby a score. And that score determines their risk for infection after delivery and will tell the team if your baby needs vitals more often or if they need to start antibiotics on the baby. So any change in vitals plus a high score will give us concern for infection in the baby.
Right. And I know I remember when you were born, Rachel, you
Yep.
did have an infection and it developed pretty quickly right after delivery. And it was pretty scary. But if they hadn't been checking your vitals, I imagine it could have gotten a lot worse, a lot quicker.
Exactly. Yeah. Even though baby's rooming in with you, we keep a good tabs on the baby. And vitals can clue us in also on any breathing issues for the baby. Babies don't use their lungs while they're in your belly. So
No,
breathing's a
they're
new thing for
underwater.
them. Yeah.
Right. They're underwater.
Yeah, exactly. So breathing's brand new to them. And for some babies, it can take them a little bit longer than others to get the hang of it. So vitals can clue us in on also any issues with the heart. So just like the lungs have to transition to life outside of the womb, so does your heart. And some babies can be born with holes in their hearts or congenital heart defects or parts of their heart that are supposed to close up at delivery and maybe don't. And these things can cause issues once they're born. So vitals can clue us in on all those things.
Right. I know that a lot of times we're also checking babies' blood sugar levels, blood glucose
Mhm.
levels. So when do we do that and why? Because they don't always check it. That's a thing that's
No,
kind of,
yeah.
yeah, different.
Yeah, there are protocols for it. Yeah, but
Mhm.
they'll check babies' glucoses if they're symptomatic. So, just like if you have low blood sugar, babies might be extra jittery, extra sleepy, or might even have trouble breathing. And then they'll check the baby's glucose just to see if that is why they're having those symptoms. And if it is, then they'll say, hey, maybe you should feed your baby, or they'll give them extra glucose.
Feed your
Um,
baby.
but yeah, feed them.
Mhm.
But there are also certain protocols for babies who need glucose checks based on their risk factors. So, for example, small babies, so that's
Mhm.
called SGA, small for gestational age babies, or very big babies, large for gestational age babies, LGA babies. Babies who are born too early, if they're born preterm, or if babies have a mom with diabetes, either gestational or type 1 or type 2. So, all of those put you at a little bit higher risk for low glucose. And so, we'll just go ahead and check the sugars on those babies automatically. So, depending on their risk factors, they'll be screened for 12 to 24 hours. And that means they'll have their glucose checked with every feed. If their glucose levels are low, the team, like I said, will have you feed the baby, or they might give them a glucose gel, which is a just a gel that they give the baby in the mouth. Or if they continue to be low, they'll start an IV and give the baby IV glucose. And no, at most hospitals, I feel like at that point, if you're
Yeah.
starting IV glucose, you'll probably end up the baby going to the NICU for further treatment.
Right. Right, and at our hospital, that's one of the places where we would be shipping the baby out because I work at a
Yes.
very rural, hospital that's small, and, we don't have a NICU, so our
Yeah.
baby would end up being shipped to a big city at that point, yeah. Yeah,
Yeah, if you're in a rural hospital, it'd probably be the same.
yeah,
End up going somewhere. But most babies end up fine. If we can feed them or give them more sugar, then they normally are able to do well. And the more they eat, they can hold their glucose.
perfect, perfect. So, Rachel, other than vitals and glucose level, what will the baby's team be doing?
Yeah, so if everything goes smoothly with delivery and transition, and their vitals are stable and their exam is normal, the baby team will get the baby prepared to go home with you. So after
Yay.
20, yay. So after 24 hours of life, there's a checklist of things that has to be done to make sure your baby's ready to go home.
Yeah, like, for example, what kind of things would we do? What's on that list?
Yeah, so the checklist includes the newborn metabolic state screen, the congenital heart disease screen, a bilirubin check, and a hearing screen.
Okay, so I know about those things. Why don't you tell us a little bit about each one of them?
Yeah. So, first, the newborn metabolic state screen. Every state has, every state's different, but they have a list of congenital diseases that they test for, based on, state regulations. But most of them include things like cystic fibrosis, thyroid disorders, um, different other congenital diseases as well. But every state's a little bit different, and you can kind of Google what your state checks for in that. But what it entails is they take baby's heel and they poke it, get a little bit of blood, and yeah, it's sad for a second, but it's just a poke. It's not like a needle stick or anything. But the state issues these pieces of paper, and the nurse will take the baby's heel and put 3 drops of blood, 3 or 4 or 4 or 5 drops of blood in these little circles on the sheet of paper. And then the sheet of paper gets sent off to the state and they test it for those diseases. And then your pediatrician will get a report back after a few days. Normally within the first week, you get the report back and it says normal or it says abnormal. And when it's abnormal, we try not to freak out because it's just a screening. So anything that's a screening, don't freak out. It's not like a diagnostic definitive test. So if it's abnormal, your pediatrician will kind of guide you on the next steps. But most of the time, we just collect more blood again and retest.
Right. But I know that a lot of the things that the a metabolic screen tests for could be very dangerous or life-threatening if they're not identified really early on in life. Like, if we don't pick up on it
Exactly.
quickly, it can be, like, devastating for the baby.
Yeah,
So, super
exactly.
important.
Yeah.
Yeah,
Very, very
yeah.
important. Yeah, exactly. And a lot of times your infant's not going to show symptoms of these things until
Right.
it's really
Uh,
too late. So
right.
that's why we do
Yeah.
this screening is so we can pick up on these tests early and and do what we need to do to fix them so that your baby doesn't have issues later on down the road like thyroid disorders, for example. If your baby has issue with thyroid, you might not know or they might not show symptoms for months and months. And by that time, it's normally too late and they've had significant brain damage from that. So,
Right. Right.
um, it's very, very important test. Another thing I want to say is some states will do two. Where I live in Colorado, we do two. I've lived in Kentucky, Tennessee, and Virginia, and they all only did one, right? 24 hours after birth. But
Yeah, we
Colorado
only
does
do
two.
one. We only do one in Alaska also, just one.
Yeah, I know. I'd never lived somewhere until recently, but Colorado does too. They do one at 24 hours, and then they repeat a couple of the tests at 2 weeks of life,
Hmm.
just to make
Okay.
sure that they didn't miss anything or they
Hmm.
weren't abnormal for other reasons. So, yeah. So sometimes you might be asked by your pediatrician to repeat it in a couple weeks.
Gotcha.
Okay, so that's the newborn metabolic state screen. The second one is the CCHD. That is the critical congenital heart disease screening. And
And this
basically,
one This one does not include any kind of poking or taking of
no,
blood or heel stick, nothing
no,
like that, right? This one doesn't
no,
hurt. No.
no,
Okay.
it doesn't hurt at all. I mean, babies can be cranky and cry, but it doesn't hurt. Basically, what they're going to do is put a sticker on your baby's wrist and a sticker on your baby's heel. And the sticker has a little light in it that's going to shine and give you their oxygen saturation. And if, um, depending on the numbers, it can tell you whether or not they are screening positive for a congenital heart disease, where some babies have a hole in their heart. It makes it so oxygen doesn't move properly in their heart, and it can make their oxygen saturations abnormal. And what's really interesting, and I've learned recently, is that this screen, you can get more false negative, or you can get more false positives. I don't know. You can get more people who screen positive for congenital heart diseases in higher elevations. So here where I live in
Mm.
Colorado, we're above
Because
6,000 feet.
you don't have air there, right?
Right, exactly. We don't have enough air. So they've noticed that a lot of babies just have lower oxygen saturations initially. And they're thinking about lowering the threshold for babies
Hmm.
here, but they haven't yet. So you might want to take that into consideration too when you're having your baby. Are you at a higher elevation?
Yeah, well, we're pretty much at sea level here, so I think we're
Yeah, if you're at sea
yeah,
level, no excuse.
no excuse. Right.
But yeah, it screens for congenital heart diseases, so babies who have holes in their heart. And if they screen positive on this test, then most of the time your doctor or nurse practitioner is going to order an echo for your baby to look at your heart more
Right.
closely to make sure that there's no holes in the baby's heart that we're missing.
Right.
Yeah. Um,
And then the
Three,
bilirubin check.
the bilirubin check. So I know most people know that babies have issues with jaundice after birth, where they turn yellow or orange like a Oompa Loompa. And some babies will turn more orange than others. It's all dependent on a molecule called bilirubin in your baby's blood that comes from the breakdown of red blood cells. So, birth is really traumatic. They can have hematomas on
For
their
moms
head.
too.
Yeah, for everybody, but even for babies, they're squeezed.
Yeah.
But my son, we had to use a vacuum to get him out, so he had a big hematoma on his head, and that's a big blood collection. So when that blood breaks down, you're going to have extra bilirubin in your blood. Same thing with, we've started doing this thing where we leave the baby hooked to the umbilical cord for a longer period of time, like a extra minute of leaving the baby hooked to the umbilical cord so that the blood can flow through there. But more blood's flowing through, so that means your baby's going to have extra blood to break down, so their bilirubin is going to be higher too. So basically, there's lots of ways to check the number for bilirubin in the baby's blood. There is a transcutaneous, which we use at the hospital I'm at now, so you don't have to poke the baby at all there either, which is really nice. It's just a little machine. They hold it to the skin and it gives you a number. And then if your hospital doesn't have that, they might need to poke the baby's heel.
That's what we do.
Or,
That's what our
yeah,
hospital does. Yeah.
the last hospital I came from poked the heel too. It's a little bit more accurate to poke the heel, but it's nicer the other way because you don't have to poke them. But then they'll send the blood to the lab, and the lab will give them a number of bilirubin for their blood. There's a whole protocol, but basically, depending on that number, is when we may or may not need to start the baby on phototherapy. Now, phototherapy, just like the sun outside, is going to break down that bilirubin in the baby's blood and make it less in the baby's blood.
So this
Make
is
the
where the
number
baby
lower.
gets the little sunglasses and they lay
Mm-hmm.
under the sun and tanning
Little
light.
baby tanning bed. Yeah.
Yeah.
Exactly. It's the little sunglasses and tanning bed for baby. But if we don't do phototherapy in the baby, there's always a risk that the bilirubin can get so high it'll cross the blood-brain barrier, and that bilirubin can go to the brain and cause brain damage. And it's so easy to put them in phototherapy. It's really easy to treat, and so there's no reason we need to have any babies who have brain damage from this at all. So if you're worried about your baby being orange, you just got to ask somebody about it. And yeah, so they'll check that 24 hours after birth. And depending on the number, you'll either hear your doctor or nurse practitioner talk about doing phototherapy or not. Now, if your baby is really close to the number of needing phototherapy, they might keep you extra longer in the hospital.
And check it again, right?
To check it again. Yeah. Sometimes they'll want to check it again at 36 or even 48 hours to make sure it's not going up super high. And,
Right.
if they recommend that, it's a good idea, because I don't know how many times I've had patients come to me and then I've had to readmit them back to the hospital afterwards for phototherapy. So might as well just stay if they're recommending that and get the phototherapy if you need it.
Right. Right. And I've heard breastfeeding more frequently can also help lower that,
Yeah.
right? Yeah.
Yeah. So eating and pooping is how you get rid of the bilirubin. You poop it out. so,
Okay.
so as much as they'll eat in the hospital or outside of the hospital is great, because they'll poop that out for you.
Great. Great. Okay. And what
Okay.
about hearing screen?
Yeah, the hearing screen. It's so funny because before I went to med school, I did the hearing screens in the hospital. It's such a fun job. But the big thing I want everyone to know about this is it is just a screening. Just a screening. So don't freak out if they fail, like I did when my son failed.
Yeah, you did. You did freak out.
Yeah, I did. I cried, even though I knew it's just a screen. But someone normally will come into your room. Sometimes they do them in the nursery if your baby's there, but they'll come into the room, they'll put stickers on baby's head, and play sounds in their ears, and they'll test baby's brain's response to those sounds. And there are a lot of factors that can make a baby fail. If C-section babies, they fail more frequently because they have fluid in their ears after delivery that doesn't come out as well because they're not squeezed
They
out.
don't get squeezed, right?
Yeah, they're not squeezed out like vaginal delivery babies. But then even vaginal delivery babies can have fluid in their ears still. The test is very sensitive to baby movement. So if the baby is wiggly at all, or sucking on a pacifier, that can affect the test too. So there's a million things that will affect the test and can make a baby fail. That doesn't mean that they have issues with hearing. So normally if they fail, you'll sometimes get another chance in the hospital, but after 2 fails, then you'll be referred outpatient to have the screen redone. And up until a couple months ago, I didn't know what happened after that. But my son failed the screen outside of the hospital as well, which is why I cried. But after that, then you are referred to an audiologist who does a diagnostic screening. So it's very similar to the screen, not a diagnostic screening, just a diagnostic test. And it's very similar to the screening tests where they play the sounds in the ears with the stickers on the head, but something makes it more diagnostic than the screening. I don't know what it is, but then you go do that, and then you'll get a official answer. Yes, they have issues hearing, or no, they don't. But this test is super, super important because 1 to 2 out of every 1,000 babies are born with some type of hearing issue. And if they have a hearing issue, it affects everything, right? It affects their social interactions. It affects whether they learn to talk. It affects all of their development. And so if you can catch it early, you can treat it early, and then they won't have as much issues learning to speak, learning to be social as they get older and develop. So it's super, super important. But if they don't pass, don't freak out.
Right. That's really good advice.
Yeah.
So Rachel, earlier you promised that you were going to talk to us about the vaccines that are recommended for babies to have before they go home, right?
Yes. Yeah. So usually infants will receive 2 injections right after birth. Just like we said earlier, they're going to get the hepatitis B vaccine and a vitamin K injection.
So I remember when you were born, we were not giving hepatitis B vaccines to babies. But now we say that it's important to have that after birth. And I know that hepatitis B is a sexually transmitted disease and that we screen moms for that. And we would know if mom had hepatitis B. So tell us why it's still important that the baby get that vaccine.
Yeah, I get this question so much from my patients' parents. But yes, hepatitis B can be an STD. It's spread by body fluids, so through sex or blood. And most pregnant women, you're right, are screened for hepatitis B prior to delivery.
Right.
I have had some midwife patients who are not screened for this prior to delivery, but most, yes, even midwife
Right.
patients, most are screened prior to
Right.
delivery. However, there is a time frame after being infected with the virus when people are asymptomatic. So women might not even know that they have this virus when they give birth.
Mm.
I think most people are screened for this at the beginning of
Right.
pregnancy.
At the beginning of pregnancy, right.
And there's 9 months that something could happen.
Okay. You got a point.
And then, infants can contract the virus from mom during delivery. So, yeah, it's important. Also, the longer you have the virus, the worse the consequences are. So when kids
Mm.
are infected with the virus at a young age, they have a higher risk of having liver damage, needing a liver
Mm.
transplant and liver cancer later in life. Um,
Wow.
Also, the hepatitis B virus can live on surfaces for up to a week. And there have been some cases where people were infected in ways other than sex. Like I was just reading on the CDC's website, 2 cases were reported where kids were infected by another kid at daycare who bit or scratched them.
Oh, that's
Another
awful.
case,
Yeah.
another case where 2 people were infected by a glucose monitor.
Mm.
And then another by an acupuncturist who infected over 30 people. Um,
Mm.
so you really just never know how your baby could be infected by this. God forbid this happens and that your baby gets it. But if they do, you want them to be protected. And like I said, the longer you have the virus, the worse the consequences are. And
Right.
you just I would rather have them protected than not, because you really don't know. Rather
Right.
be safe than sorry.
Right.
And it's a safe vaccine. So if you weigh the risks versus the benefits, I think the benefits of this vaccine far outweigh the risks. So that's why we
And
recommend it.
I know it's a vaccine that's been around for a while, and it's also one of the
Mhm.
ones that are required for most children to go to school, that they have to have
Yeah.
had hepatitis B. So it's a common vaccine that most of us got when we were kids anyway. Yeah. So let's talk about, why would a baby need vitamin K injection? That's
Yeah.
funny. Vitamin K.
Yeah. Vitamin K is given to infants right after birth, like I said, and we all need vitamin K to make blood clots.
Mm.
Adults, we get it from what we eat, which is nice, but infants, they're not born with enough vitamin K, and they're not really able to absorb enough until they start eating solid foods, which is normally at 6 months of life. Even breastfed babies don't get enough vitamin K. And like I said, you need it for blood clotting. Vitamin K supplementation decreases the risk of something that we call vitamin K deficient bleeding, which used to be called hemorrhagic disease of the newborn. And this is
Mhm.
very scary.
Right.
Infants can have bleeding in their internal organs and into their brain that can cause really significant damage and even death. Um, and without the extra vitamin K supplementation, the rate of this vitamin K deficient bleeding disease is about 1% of infants and can occur up until 6 months of life. So it's not something that'll happen within the first week of life all the time. It can, but sometimes it can occur up until the baby's 6 months old. They just don't have enough vitamin K. So infants who receive the vitamin K injection at birth are 81 times less likely to have an occurrence of vitamin K deficient bleeding. So it's super
Wow.
important.
Yeah. So I know several patients that have had their babies suffer from this. And you're right, it's very devastating. And it can be lifelong effects. Yeah.
Yeah.
So, but let me ask you this: why does it have to be an injection? There's a lot of people here, especially, that talk about using oral vitamin K, because there's some midwives in town that give their patients oral
Yeah.
vitamin K drops, right? So talk a little bit
Yeah.
about that.
They're just starting to really study the oral vitamin K drops, and they do use oral vitamin K in other countries. It's not currently recommended here in the United States because it's only effective if it's used weekly for the first 3 months of life. So you have to remember in the
Yeah,
postpartum period, after you've just had a
yeah,
baby and you have all these things to remember, you have to
and you're not
remember to give.
sleeping.
Exactly. You're not sleeping. You don't even know what day or week or month it is, but you have to remember to give them every week this oral medication for the first 3 full months of life. And that can be hard to remember. Um, but the studies that they're doing are new, so you might see an oral supplement on the market at some point in time. But as of right now, the injection's just standard of care. It's just one injection that they need right after delivery, and they're covered. So you don't have to worry
Right.
about giving a medication every week.
Right. Now, I have a lot of parents that don't want one or more of these interventions for their child.
Yeah.
And they want to know, does my baby really have to have all these things? What about if a parent wants to opt out and not get one of those things for their
Yeah.
babies?
Yeah, I mean, obviously, all of these things are standard of care, and we recommend them really highly. And we've kind of talked a little bit about why. And if you have questions, you just have to message us, and I'm happy to answer any questions about why these things are super important. But if you do decide to opt out, you have that right. It's your baby. You get to make that decision, like we said. Um, but the hospital should have a way for you to opt out of these tests and injections. You just have to ask somebody. Some of these things you might have to sign a form saying that you understand why they are recommended and you're still choosing to opt out. And it might affect some of the other options you might have. Like, for
Right.
example, yeah, if you opt out of vitamin K injection, there are some providers that might not be willing to perform a circumcision on your infant if you have a boy and you want a circumcision, because there's an increased risk of bleeding after the procedure, after the circumcision. And if you're opting out of vitamin K, they might not be willing to take that risk. But like I said, everything's your choice, and you can always say no, thank you.
That's right. Yeah, parents always have a final say in everything. So,
Mhm.
what else can the baby team help with? What else does the team of people providing care for the baby, what do they do?
Yeah, they can help with anything you need. They're really great about answering any baby questions, not just medical baby questions like if you need help burping the baby. I don't know how to burp the baby. Ask somebody. They'll know, they'll show you.
Yeah.
But just don't ask them about you. If you ask them mommy questions, they're going to point you in the direction of your nurse or your doctor. But any baby
And
questions,
and
they'll help.
and don't ask your OBGYN about your baby because I will tell you to ask the pediatrician or the
Yeah,
baby
ask
provider.
someone else.
Yeah, yeah,
Exactly.
yeah.
But they can help with the circumcision too, if that's something that you're wanting to do. For the circumcision, usually an OB, a pediatrician, or a nurse practitioner will perform that procedure. And most of the time, they'll take the infant to the nursery to do the procedure, and they'll bring him back after it's over.
Right. Now in our hospital, it's mostly the family practice doctors that are doing the,
Yeah.
circumcisions. But, for the circumcision, the baby is usually taken out of the room to a separate space, and, some places, I know we allow dad to accompany the baby if they want to. A lot of dads don't want to be there for that, and I don't
No,
blame
I'm
them.
sure they wouldn't.
Yeah, yeah, but, um but for circumcision, the baby has to have their little legs, Velcro strapped down so that they don't kick or move, obviously, and we apply, like, a numbing, gel or cream, to the area that's gonna be circumcised beforehand. Some people give injections of numbing medicine, but not always. Um, some we give the baby like a little bit of sugar water, maybe on a pacifier
Yeah.
that they can suck on, and that
Yeah.
calms them down a lot because as soon as you put their little legs, strap them down, they scream. You haven't even
Mm.
touched them yet, and they're
Yeah.
screaming.
Yeah.
Babies don't like to be unwrapped from their little swaddle
They
and
do not.
strapped down. They do not. Yeah. So there's different ways to do circumcisions. I know when I was doing them, I used a device called a Gomco and
Mhm.
actually excised the foreskin so it was completely gone. There's some people that use a little Plastabell that the bell stays on a plastic bell stays on top of the penis and eventually it falls off. And when it does, the
Mhm.
foreskin does as well. And then there are also other types of circumcisions, like ones that are done with Mogan clamps, but you get the same effect pretty much with all of them. I do know that there are some religions, like Jewish people, will often wait until day 8 of life to have their baby circumcised. That's a thing. And here, where I live, we have a community of Russian Orthodox believers, and they also wait and have their baby circumcised and named at day 8. That's a big ceremony
Oh,
that they do.
nice.
So yeah, so there are different religious ceremonies that might also be involved with that. But after the procedure is done, no matter how it's done, as the mom, you're going to need to take care of that area because it's going to be sensitive and tender. So, and you'll want to follow up with your pediatrician also. So, Rachel, why don't you talk about that? How do we care for them?
Yeah. Yeah, so you're not going to see your OB normally until 6 weeks later. Or really, I didn't see the person who did my baby circumcision at all after the fact. So,
Yeah,
yeah, your pediatrician is normally the one that follows it as it heals. So if you have any questions about how it's healing or care for the area, you just have to ask your baby's doctor. And, all of the moms who I see after they get out of the hospital, they all say, "Can you look at his penis and make sure it's okay?"
right, right, right.
Because they're all so worried. But most of the time, they heal super, super well. And most don't have any issues at all. So, yeah, if you have questions about it, ask your doctor. The biggest thing is going to be, um, putting the Vaseline or some type of
Right.
ointment on the area for 2 to 6 weeks after delivery, just to make sure it doesn't stick to the diaper or to itself. But they'll give you all the care instructions when you leave the hospital. And then just if you have questions, you normally see your pediatrician the day after you leave or 2 days after you leave. So just chat with them and they'll give you all the advice that you need.
Yay.
Yeah, so pediatrician can help with circumcision stuff. But another thing that the baby team in the hospital can do is help with all things feeding. So if you choose to breastfeed or bottle feed, formula feed, either way, the hospital will help you with anything that you need for that. Um, if you choose to breastfeed, most hospitals will have a lactation consultant on staff to help you, which is really nice. They can help you with latch, really anything. They're very knowledgeable about all things breastfeeding, and no question is dumb. They, like I said earlier, they can help you burp the baby. They can help you change diapers, anything. The baby team is there for you. Don't
Yeah.
feel dumb asking anything.
So I've heard of some hospitals having the designation as being baby friendly hospital. What does that mean exactly?
Yeah, Baby Friendly USA, it's an accrediting body actually that gives a special designation to hospitals that take special initiative to make sure that parents have the knowledge and support that they need to feed their babies. Breastfeeding is very, very hard. If no one has told you and you don't know that, it's very hard. It would seem like it
Yeah,
should be easy
right.
because
People
it's
think
really
it's going to be easy.
natural.
Mhm.
Because people have done it for centuries, years and years. People do it in third world countries, but newsflash, it's not easy at all. It's probably one of the hardest things you'll ever do. Um, and baby friendly hospitals, they make sure that their staff has the education and the time to help moms through the transition to feed their babies. And make sure that babies have what they need to be able to breastfeed too. So it's really, really nice if your hospital's baby friendly.
Yeah, great. So I think the baby team really does a lot, right?
Yeah, they really do. They'll do other things too. So they'll weigh the baby every day to make sure they don't lose too much weight. Um, Some babies too will need extra tests like a car seat test. If they're really small babies or if they're premature babies, they'll have to do this car seat test to make sure they can sit in the car safely for an extended period of time.
Oh,
Yeah. Other babies will need something called a CMV test, which is cytomegalovirus test. And this is either a urine test or a cheek swab test to make sure they're not infected with CMV, which is a virus. JJ had to have this test done actually because he failed his hearing screen. So if your baby
JJ.
fails their, yeah, but his was negative for CMV, which is nice. But yeah, if they fail their hearing screen, if their heads are small, sometimes there's different things, but they'll test them for CMV. And other babies might need a drug screen on their urine or their poop that they poop right after delivery. Um, yeah, for different reasons. And they can also get in touch with social work to help you if you need different resources in the community and things like that. So they do so much. And it's just funny, a lot of people don't realize that the babies have their own staff too, and they have a lot that they have to
Yay.
do.
Yay. And I'm so glad that they do.
Yeah.
Yeah. So
Mhm.
Rachel, that's awesome. Thank you for all that really helpful information. I'm sure all the moms that are getting ready to give birth are going to really want to know all that stuff beforehand. So thank you.
Yeah, for sure. But if you guys
Yeah.
have any other questions about any of that or comments, feel free to leave a comment or direct message us on Instagram. We're at mama.baby on Instagram, or leave a comment down below. We'd be happy to hear from you and answer any questions.
Yeah. And if you don't already subscribe to our podcast, please subscribe. And if you could leave us a review, especially if it's a good one, that'll give us, that'll help other people be able to find our podcast. So we